and our Director of Ceremonies, the Honorable Vice President, Colonel Retired K.C.D. Mahdi, the National Chairman of ZANU-PF and the Minister of Defense, Honorable O.C.Z. Mchinguri Kashiri, the Minister of State for Harare Metropolitan Province, Honorable Charles Tabengwa, the Minister of Health and Child Care, Dr. Mombeshura, and the Honorable Ministers and Deputy Ministers who are here, the Chief Secretary to the President Cabinet, Dr. Martin Rushwaya, Chairman of the Public Service Commission, Dr. Vincent Ungwe, senior government officials who are here, the Mayor of the City of Harare, His Worship Councillor J. Mafume, the Chief Medical Officer, Parirenyatwa Group of Hospitals, Dr. T. Magure, Chairman of Prevail Group, Comrade Tungwarara. Comrades and friends, ladies and gentlemen, it is my singular honor and privilege to officiate at this historic milestone marking the commissioning of newly refurbished Adlam House and Nurses Home here at Parirenyatwa Group of Hospitals. Today's event and the beautifully refurbished infrastructure before us is another confirmation of the success of our development philosophy. Nika igona matirwa igotongba. Hallelujah. We are further celebrating unity, hard work, and the shared national determination to transform and modernize every sector of the economy. Ourselves, I say congratulations, Makorokoto and Flow. Undoubtedly, a nation's development is inseparable from the general well-being of its people. Under the Second Republic, my administration is modernizing our health system through infrastructure development, human capital development, and capacity building, as well as improved service delivery. These facilities dovetail with the broader goal under Vision 2030 to build an upper middle income economy anchored on a healthy, productive, and empowered population. The transformation we have seen here has been realized under the whole of society approach. That is the public, the private sector, and the general citizenry working hand in hand to build our great motherland, Zimbabwe. Sector by sector, we must continue to have confidence in our own skills, our systems, and innovations Well done to all the teams and stakeholders who worked tirelessly to make this project a reality. No nation or community develops by depending entirely on others. It is also commendable that this exceptional and indeed breathtaking makeover here at Parirenyatwa Hospital was achieved through the use of our own local resources. This is how it ought to be. Let us always strive to use our own brick and mortar, steel and wood, and all other products to consolidate and broaden the value chains of our country's construction industry. Overall, it is pleasing that notable progress is being made across our health delivery sector towards the realization of universal health coverage, as well as access to affordable, quality and specialist health services. The reduction of maternal mortality reflects strengthened maternal and child health services in our country. Life expectancy is also rising, a testament that the interventions deployed by government alongside other stakeholders are yielding positive results. Additionally, we are strengthening specialized care and emergency response systems in our country. Modern and digitally enabled medical equipment is being procured and installation is underway across our health centers in the country. This broad and proactive shift being championed by my government entails that patients receive diagnosis and treatment plans in a single visit. The pursuit to create a resilient as well as data and evidence-based national health system that maximizes patient outcomes across rural and urban areas is being accelerated. Under this strategy, district and rural health centers, including clinics, are enabled to provide a level of patient care and treatment previously reserved for the referral and central hospitals. Our air ambulance system is scoring great milestones with over 2,000 evacuations conducted to date, supported by strategically located bases across the country. No one and no place is being left behind. The Presidential Hospital Renovation Program is ongoing nationwide and will reach every hospital across all districts in the country. So far, work has begun at Mpilo and the Salimgaba hospitals, as well as here at Parirenyatwa group of hospitals. I am particularly pleased with the progress on the refurbishment of Mbuya Neanda Maternity Hospital. The women of our great country, no matter where they live, deserve dignity. They deserve safety and comfort as they access quality health services, including prenatal, antenatal, and postnatal services, among others. My dear invited guests, comrades, and friends, no health system can function without skilled, disciplined, and committed professionals. As such, human capital development remains at the center of our national socio-economic progress. Hence, my government established the Health Service Commission to oversee the training, retention, and the motivation of our health workforce. Through this initiative, we are building technical competencies on one hand and entrenching discipline, ethics, loyalty, and patriotism across the health professionals on the other hand. Student nurse training and medical education are critical pillars of our health system. Nurse trainees, along with doctors and all other health care personnel being trained throughout institutions of higher learning, are the backbone of the health delivery system of tomorrow. My government stands ready to scale up the requisite support to ensure that they have suitable and well-equipped facilities appropriate for their training. May I take this opportunity of this occasion to express my profound gratitude to all the tutors, consultants, and the clinical instructors for their role in building a cohort of world-class and a highly sought-after health service personnel. Congratulations. Our nurses are sought for, even in the first world, like America and Britain. They look for them. But your work is often behind the scenes, but its impact is profound and far-reaching, not only within the country, but on the African continent and beyond. These standards should never be compromised. As government, we recognize your efforts. We will do more to support and complement your efforts. I say to you, well done, well done. To the trainees, student nurses, and other health service personnel who will pass through this institution, may the transformation of these premises serve as a source of inspiration, not only in your respective professional journeys, but also in your private lives. I know that the years of training in the health sector, like in other fields, is not easy. It demands sacrifice and endurance. But it is through this process that you will be professionals who can stand shoulder to shoulder with others from across the world. Rise up to the challenge. Never, never look down upon yourselves. All things are possible. Dare to dream. Work with zeal to achieve your set goals and transform your future. Take pride in wholeheartedly providing life-saving health care services to your communities, to your parents, siblings, and your relatives. Ngazvikufadzei kurapa nokuraramisa mhuri yeZimbabwe. Always remain mindful that nyika inovakwa, igotongwa, igonematirwa. Hallelujah, Jehovah ari kudenga. Zimbabwe is our only God-given motherland. The onus is on us to build and modernize it into what we desire. Through hard work, perseverance, focus, brick upon brick, and step by step. The improvements and, in some cases, complete overhaul of the student accommodation and welfare facilities here at Parirenyatwa is a gift of the environment which I, as your president, desire for you, our young professionals. The establishment of recreational, sports and leisure amenities, including the swimming pool, must be effectively used for the holistic physical and mental well-being of the students. The swimming pools are not created for you to drown in, but to swim. We want this institution to churn out medical professionals who are both competent and socially balanced. May I emphasize that discipline, acting in the national interests, and saving lives remains central in our health sector. On its part, my government is committed to providing conditions of service and addressing the legitimate concerns of our civil servants. I underline legitimate concerns. The impact of service disruption on patients, including ordinary citizens and economy as a whole, cannot be ignored. My administration will continually engage and dialogue with the health sector for the realization of sustainable progress and win-win solutions. As I conclude, may I highlight once again that the success of this Adlam house and the nursing home refurbishment project reflects the importance of partnerships. The collaboration between our government, the private sector, and development partners showcase what can be achieved when we work together towards a shared goal with unity of purpose. I commend our various partners, including the Angel of Hope Foundation, for strengthening outreach services and improving access to health care. More partners and players, including our nationals in the diaspora, are invited and welcome to play their part in the ongoing irreversible journey of infrastructure modernization and transformation in the health sector and social services in general. The commissioning of this project is not the end of the road, but an important landmark on a journey a long journey. Let us, therefore, remain focused in our ongoing quest to build a modern health system characterized by enhanced patient care, quality services, and improved working conditions for our professionals, who must serve all the people of our great motherland, Zimbabwe. With these remarks, it is now my singular honor and privilege to declare Adlam House and Nurses Home here at Parirenyatwa Group of Hospitals officially commissioned. God bless you all. God bless Zimbabwe. Thank you.